Good morning, everyone. No financial disclosures enclosed. My topic for today would be pharmacological modulation of autophagy and its therapeutic potential in pathogenesis of pterygium. So what we know is pterygium is a fibrovascular growth, and there are multiple etiologies to it. What we don't know is why is the recurrence happening even though we apply all the surgical techniques. The prevalence of recurrence ranges from 5 to 69%. So what is autophagy? Autophagy is, in simple words, cell eating cell to maintain homeostasis. What is the aim of our study? To investigate the role of autophagy regulation and its therapeutic applications for clinical management of pterygium. The first research question would be, does dysregulated autophagy has a role in pathogenesis of pterygium? So the methodology that we used were, we had taken 20 control conjunctival tissues which were obtained from cadaveric eye and 20 pterygium tissues which were obtained post-surgery. These underwent protein separation using Western blotting and immunofluorescence, and expression levels of autophagy-related proteins were analyzed. We did an in vitro study where 20 pterygium tissues were obtained post-pterygium, which were taken to the lab in three different Eppendorf tubes as subconjunctiva, body, and head, and different autophagy-related proteins were analyzed. So what are autophagy proteins? Proteins that are involved in the formation of autophagolysosome to cause autophagy. So the results that we obtained were, majority of the autophagy proteins were seen showing less expression in the pterygium tissues as compared to the control conjunctiva. The immunofluorescence microscopy of control conjunctiva and whole pterygium shows that the autophagy protein LC3B shows less expression in the pterygium tissues compared to the control conjunctiva. So the second question would be, is there a correlation between autophagy activity and fibrovascular density in different regions of pterygium? So differential expression, in our study, we saw that the subconjunctival part had the least amount of autophagy proteins as compared to the body, as compared to the head. So can it be related? The third research question would be, can autophagy modulating mechanisms halt the progression of pterygium and prevents its recurrence? So this is immunofluorescence study with LC3B autophagosomes, where the untreated and the treated eye with trehalose, which is an autophagy modulating drug, showed that the nucleus part, and the nucleus part is the blue part and the red part is the autophagy related protein part, where it shows the increased expression in the sample where we put an autophagy inducer, which was the trehalose. So coming to the discussion, the established role of trehalose in the induction of autophagy is already studied in the dry eye disease, but we haven't studied it in pterygium tissues. The ongoing study for our presentation would be role of autophagy modulating drugs in preventing recurrence and halting the progression when used in early stages in patients with pterygium. So what we already knew was, pterygium is a fibrovascular growth of conjunctival tissue. There is an increase in angiogenesis, fibrogenesis, and inflammation that leads to different forms of pterygium in different patients, and we don't know what the particular etiology in particular patient is. The treatment modality is as far as surgical excision. What this study adds is, based on the in vitro study that we did, we cultured the conjunctiva and the pterygium fibroblast tissues, and we saw that the autophagy modulating drugs might prevent the recurrence of the pterygium, and there are differential expression of autophagy proteins at different parts as the subconjunctiva, body, and head, and it can be helpful in halting the progression while pterygium is at an early stage. Thank you.
Yeah, thank you, Dr. Apeksha.
Thank you, ma'am.
I would just like to ask you one thing. Any reason you could find out that how the autophagy is triggered in subconjunctival tissue, especially the nasal limbus?
So we also did was, the control conjunctivas was exposed to UV light for 10 seconds and for 20 seconds. So the major cause that is known for pterygium is the UVB induction. So for the first 10 seconds when we expose, there is an increase in autophagy as compared to when there is prolonged exposure to UV light. The autophagy proteins significantly come down after UVB exposure.
And its relation with the location of the pterygium, why it is more common in the nasal side rather than because the...
Yeah, so what is known is because the UV light falls, because of the nose it falls on the nasal and temporal part. So mainly the nasal part. So because of that, the pterygium is more common around that.
Thank you.
Thank you, ma'am.